The triple crossover hop for distance, again, is very similar. So what we've got here, and what I tend to use in clinic, is a hop mat that's been made up. This is of 15 centimetre width. So this was how the test was originally published. There was a little bit of ambiguity with respect to the nature of the first hop, but in subsequent reports, what we are after here is, let's say it's a right leg. I want to start on the left side of the mat, and the first hop is going to be lateral. So what we are after here is a continuous triple crossover hop and aiming hopefully for a controlled landing on number 3. So we'll give this one a go. Again, I want to make sure that you do not touch the mat. That's really important. And I want that controlled landing on number 3 again. So nice, easy effort. Just get your head around it first. Okay, good? Yep. Happy with that? Yep. All right, well, let's just try and work a little bit further. Good. So it is fair to say that whilst I don't want Jordan landing on the mat, if they take that hop a little wider, they will effectively end up sacrificing distance. So it is a bit of a juggling act between keeping it narrow enough to maximise distance, but also ensuring that it's not too narrow, that they are actually going to be touching the mat or potentially landing on that mat. So those 4 hop tests we have seen used quite commonly. Again, they were published more than 30 years ago. They are the 4 hop measures that have been used quite exhaustively in published orthopaedic research, and we certainly see them used quite commonly in ACL-based studies. What I want to have a look at next are a few different ones that have a published base, and they're things that we use quite commonly in clinic because they offer something a little bit different, but we certainly don't see them used as commonly in some of the musculoskeletal and orthopaedic lower limb research studies. So I actually want to have a look at a few side hop measures. So I'm going to start with a lateral hop for distance, and a single lateral hop and a single medial hop. From memory, they were first published back in 2001, so they've been around for a while, but we just haven't seen them used as much in the existing research. So what I might do is a quick demonstration. I'm going to go right leg. So similar to a single horizontal hop, what I want to be able to do is start with the outside of my foot behind the start point. I'm again going to permit free use of arms, but again, we may well consider fixed arms. And this is only going to be one hop. So I want to see how Jordan goes starting from a stationary position and trying to hop as far as he can laterally with a controlled landing. What I like about the lateral hop, and what we've actually seen throughout some of our own published research, is from an asymmetry perspective, in patients, particularly after ACL reconstruction, we do tend to see a higher level of asymmetry between an operated and a non-operated limb. What we've also seen is, unlike a forwards hop, where the body, irrespective of whether the hands are fixed or not, the trunk has a real ability to generate momentum. With a lateral hop, that is not the case. So all of a sudden, because the patient can't really use their arms and they can't really use their trunk, there's much more of a demand on what's happening downstairs. And we've seen that asymmetries in a lateral hop for distance are quite heavily correlated with asymmetries in quad-based strength and quad torque. Can we give this one a go? All right, so let's go right leg, so we're facing the camera. Free use of arms. Give yourself just a couple of nice, easy efforts, because it is a little bit different to that forward hop. All right, when you're ready. Okay, all right, come back, give me another easy one, maybe just working a little bit further. All right, And maybe we'll just go one more. Let's try and aim for that little bit more distance again. Good. So some of the side hops that we'll talk about, I would be more inclined to use these as single hops. They have actually been published as triple hops. So we've seen a triple medial hop and we have seen a triple lateral hop, which is a little bit more challenging again. Just a couple of other considerations here. Firstly, in patients that are doing a side hop, and we get patients that present and we might be looking at assessing their hop capacity, and they're actually quite competent with forwards hops. But as soon as you set them up with a side hop, you can almost see their head ticking over. They're a little bit more apprehensive with a side hop. So I feel as though that provides something else in itself. But when doing the hop, we have a lot of patients that might be a little bit more inclined to almost fudge on the spot. So they take off from a more comfortable position, but when they land, they're almost more inclined to turn a little bit. And again, what they're looking to do is to firstly try and increase their distance, but secondly, land in a position that is a little bit more comfortable for them.